Good morning, Keith Tebow from FRC Media. Thank you for joining us on this Wednesday. Time for our weekly chat with the mayor of the city of Fall River, Mayor Paul Coogan. Mayor, how are you today?
I'm doing okay, Keith. How about you?
I am doing well as we head toward the Christmas season. I actually want to start with something that's been dominating us for quite some time. Of course, the latest on the pandemic. Depending on when you're watching this afternoon, Wednesday, the 22nd, the city is distributing 15,000 in-home rapid COVID-19 tests at some fire stations across the city. I know we talked about this last week, Mayor, that the city got over 78,000 test. How important is to get these out, especially for people who need some peace of mind as they head to the holiday season?
Right. Well, testing right now is very tight, and people are trying to find them everywhere they can. So, the mission that the state gave us was to get them out before Christmas, and last few days we've been distributing them all over the city. Council on Aging, peer to peer, our homeless shelters, Citizens for Citizens, and People Inc. So we're distributing boxes as we can, and of course, the Fall River School Department took the lion's share. We're trying to get them in the hands of students and their parents to keep them safe over the Christmas break. So tonight we'll see how that goes. We have three spots: Globe Street, Eastern Avenue, and Stanley Street. So if people need them, all they need is a Fall River ID and show up, and we'll get them a vaccination kit, hopefully, as long as they last.
Yeah. Now, have all the others you mentioned, sending them to the schools and some social service agencies, have they all been distributed, including
Yeah,
the
everything's out
15,000?
of here. We had 38,000 delivered last Friday afternoon to the government center basement, and now they're all gone. Everything's out. And I hope people are using them judiciously, and we'll see if they can help some people to find out where they stand before the holidays.
Yeah. One note, there is a limit to the number that you can take. You can only take, I believe, two boxes, which I believe have two tests in each box. So that I guess it's a total of four tests, which could suit many families here in
Yeah.
Fall River. Will there be, if there are any extras today, do you know if there'll be any options for people to maybe even pick them up as, tomorrow even? Do you
It
know?
might be, it depending on what's left. We'll, look at what we have for a count, and then we'll bring them back probably to government center, or maybe open up one of the fire stations. But I don't know. I got a feeling a lot of them are going to go out tonight, and if not, we'll be regrouping tomorrow and trying to find a way to get those out too.
All right. Yesterday, Governor Baker announced that the state is again recommending that people wear masks indoors, specifically in areas where there's a lot of people congregating. He's not mandating masks. He's also going to be calling in the National Guard to help with some situations to support hospitals that are seeing a surge in COVID cases. Let me ask you, Mayor, has there been any determination because of the surge we're seeing in Fall River? Last week, again, over 700 cases. I believe this week we're over 600 new cases this week. Any plans about doing something maybe even in government center to, have people wear masks when they come in, or are you just going to continue to
Yeah,
see what
I
happens?
believe last week we put in a mandatory mask
Oh,
um, requirement in city buildings, whether it's the library or government center, or um, some of our stations. We want people wearing a mask in those places. Citywide, we haven't touched that yet. The Board of Health met last week and kicked it around, and they're not ready to support that at this time. So, you know, it's very difficult, because when you tell people they have to wear a mask everywhere, then it falls to enforcement, and then it turns into another whole separate issue, which goes down paths that people don't want to see. But it's 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 very, very difficult. It really is. I think that's why you're seeing Charlie Baker and Lieutenant Governor Polito hold off on this, to make sure there's other things we can do prior to. And I think part of the free test kit deliveries and the optional mask requests are things they're trying to do to buy time and see how this plays out.
yeah. Let me ask you, you're hearing whether our local hospitals, Charlton and St. Anne's, have seen an increase in cases there. I know that, people who have been vaccinated, and even though Fall River still lags behind the rest of the state, there are quite a few people here in Fall River that are vaccinated. Has that translated at all, the surge, to what you're hearing that may be happening in some of our local hospitals?
Yeah, the numbers are definitely up. They're not overwhelming yet. When we get our numbers from South Coast, it's It's for all three hospitals: Toby, St. Luke's, and Charlton. So they give us our numbers broken down like that. I believe they were maybe around 75, between 75 and 90, and it fluctuates a few every day depending on if people are coming in or going out. But it's not overwhelming anyone yet. So let's see how it plays out. I remember the first wave we had a whole satellite hospital set up in UMass Dartmouth, but it doesn't seem
Yeah.
like we're there yet.
Yeah. And I don't think we'll get there as long as people, again, continue to be vigilant and continue to get their vaccinations. In terms of cases this week, the city went over total cases since the pandemic started, went over the 20,000 case mark. I know I asked you this back in March. We sat together to talk about 1 year after the pandemic started, and now we're at the end of 2021. Um, are you numb to the numbers now? Is it something that, if you would have thought back in March of 2020, 20,000, that it may not have been, such a realistic number that we would get to that state here in Fall River?
No, I mean, you look at the number of people that have passed away across the country. I think it's over 800,000. Uh, it's like a rolling ball. It just keeps coming, and it goes through highs and lows. Um, and if we have to deal with 20,000 cases, then that's what we do. And again, you have to remember. I was talking to a gentleman this morning at the Y that had it, and it was a very, very mild case. He had a runny nose. He really didn't know he had it. So it does fluctuate. Of that 20,000, I'd love to know how many were severely ill and how many really got whacked by it and how many
Yeah.
were able to walk through it. And I think that's the problem. Um, Depending on who you talk to last, if someone got extremely sick, then you're like, oh my God, I don't want that. But if someone gives you the other description of how mild it is, you don't take it serious. But it's serious for everybody that gets it because you really don't know how it's going to affect you.
Yeah, I know, and it's one of those things, and it's also important to note that of those 20,000, there may be, some duplicative tests in their cases, right, where people may have had a couple of tests and been counted twice. So obviously, it's just a number that we can work with because those are publicly available. But the true sense, as you mentioned, is in the nuance that we don't hear at all. I want to move forward now. This is actually out the last opportunity we'll be speaking between now and the end of the year. Looking forward to January 3rd when the inauguration will take place. You'll be sworn in to begin your second term in office. Any overview yet about what we can expect on inauguration day? We know it's going to be at the New Durfee Auditorium, and it will be later in the day at 4 o'clock in the afternoon.
Yeah, that was a parking issue. We
Yeah.
tried to do it in the morning, but because the construction up there is still ongoing and the additional lots, we don't have space. So what we're going to do is roll it out at 4 o'clock in the afternoon, and then we'll go to one of the cafeterias and have a little dinner with some of the people after the ceremony and let people go home. It might end up being something we want to do going forward because it's more convenient for people that want to attend and have to work that day. And again, as far as the goals we have for the city of Fall River, we want to judiciously disperse our ARPA money to make the city of Fall River a better place to live. We had a meeting this week where we were looking at some other projects that we're working on. And again, these are all things that are at our disposal. We can really improve the city. I think you're still seeing a lot of economic growth. You're seeing a lot of houses. I think we had a meeting yesterday and we have the lowest number of abandoned property we've had in a number of years. I think people notice that houses are being renovated all over the city, and people want to move to Fall River. So that's all good news, and we just gotta keep the ball rolling and work hard for the residents.
All right, and finally, Mayor, as we head to the holiday season, any well wishes for the community as we all head into this joyous time of the season, the Christmas season and the New Year season.
Yeah, absolutely. We want people to have a safe and healthy holiday season. I wish everybody, Merry Christmas, Happy New Year, and any other holiday you celebrate. I hope it brings joy to you, and we look forward to seeing you on the other side after
Yeah.
January 1.
All right, Mayor. As always, I want to thank you for joining us week in and week out to share what's happening with the city with our viewers. I appreciate so much. Have a great holiday. Merry Christmas. Happy New Year. And we'll talk to you in early January. I appreciate it.
Thanks, Keith.
All right. And thank you for joining us here in FRC Media. I'm Keith Tebow. Have a great rest of your week and holiday season.